So most people are aware about Obamacare, or the Affordable Care Act, and the transition that has been going on in healthcare for the last several years. But one thing that has also been going on in the background is that the way that the Centers for Medicare and Medicaid, or CMS, how they pay doctors who take Medicare patients has also been changing. We're in the middle of this huge transition. And it's partly to do with the amount of baby boomers there are. There's more people going on to Medicare than ever before. We also have that conversation around Medicare for all. What would the system look like if everybody were to be on the Medicare program? And they have really thought about it. How can we actually pay doctors according to the value that they provide instead of the quantity of care that or the amount of services that they provide to patients. So we're basically right in the middle of two models. One is called a fee-for-service model, and the other is called a value-based care model. Neither one of them is particularly difficult to understand, and they're not that complicated. But the hardest part is transitioning from one into the other, and that's exactly where we are right now. So I've taken it on as somebody who has been working strategically in health IT for the last decade to kind of keep track of the ways in which CMS is measuring doctors and essentially assigning their reimbursement rate based on the quality of care that they provide. And so since 2017, they have had a very calculated way of essentially comparing apples to apples with doctors. And doctors and their staff are now responsible for understanding how they're getting measured. And it's not always something that's super clear or easy to keep track of. And so I have basically written books each year, starting with 2015, when all of these quality payment programs started to come online, just to help people understand what changes are happening and how they can navigate those changes in a way that reflects hopefully more positively to their bottom line. So I'm really excited to share that the 2020 Mips manual, which is the merit-based incentive payment system and helping doctors and their administrative staff navigate this system, it's called Mips. I've basically written the playbook to help make it easy for you. So understanding how doctors are getting tracked and measured on the quality of care that they provide through different ways. So one, tracking quality measures, another looking at their technology or their electronic health record system, making sure that they're using it in a meaningful way, that they've got improvement activities and are looking for iterative improvement year over year to kind of do better and provide better service on a whole. So, sitting behind me are 1,000 copies of my book for 2020, and I'm really excited to share them with you. So we're about to open them up.